Beautiful afternoon to you. It's always a pleasure to have you join us on the program Healthy Living with yours sincerely, Oluije Oihohai. Now today on Healthy Living, we're talking about diabetes. And to do that with us today is the person of Dr. Nosa Jolly Iguma. He is the MD, Juno's Medical Center. Good afternoon, sir.
Good afternoon. Good afternoon, viewers. It's a pleasure.
Okay, now talking about diabetes, we hear a lot of persons talking about the same issue, and they actually don't know what they should be taking, how their lifestyle should be like. So today we'll be talking about diabetes. Now, first off, what is diabetes?
Yes. The diabetes is an endocrinopathy condition. It's a group of metabolic disorder that results to the inability of the body to produce insulin or to be sensitive to the presence of insulin, thereby resulting to the elevated blood or sugar in the blood, as the case may be. Diabetes actually is like a parent name. We can have diabetes mellitus, we can have diabetes insipidus. The focal discussion that you are referring to is the diabetes mellitus, which has to do with the inability of the body to produce insulin or to be sensitive to the presence of insulin, thereby resulting to elevated blood sugar. The diabetes insipidus actually is another form of endocrinopathy, but very rare. But they have almost same symptom. In diabetes insipidus, it's actually a problem in the antidiuretic hormone. A patient who suffer diabetes insipidus will also complain of polyuria and polydipsia. What it means is that they will pass large volume of urine. But the treatment have different form. Diabetes mellitus is the commonest type of diabetes, as you know, compared to the insipidus. Diabetes mellitus is a disease that occurs worldwide. It affects the rich, it affects the poor. It affects male, it affects female. It affects old, it affects young. Statistics has it that more than 540 million people worldwide suffer diabetes. And diabetes has also been classified as one of the 5th commonest cause of death worldwide. Generally speaking, 6.7 million people die of diabetes every year. We are talking about real statistics, but I will tell you that some persons will die of complication of diabetes without actually knowing the cause of death. So what I'm trying to say is that even that 6.7 million death according to WHO is still very minimal. That is not a natural value. Okay. So the awareness of knowing the symptom of how diabetes manifests will also help to know how to be of assistance by your primary caregiver.
Okay.
Diabetes mellitus can be classified into different forms, but the commonest type of diabetes mellitus is the type 2. What happens is that any food that you eat, usually carbohydrates, that is required to give you energy, will metabolize to become glucose. And when you eat bread, for example, which is starch or carbohydrates, mastication by your tooth, salivation, the enzyme reaction from the mouth, from there it enters the stomach, from there the bread is broken down into chyme. Then when it gets to the duodenum or the small intestine, there is what we call absorption. That means assimilation process whereby the food that you are eating will not, go into your bloodstream in the form of glucose. And once whatever you eat that now gets into your blood in the form of a glucose, it will be circulating. It is that glucose that you have derived from your starch or from your carbohydrates that is the currency of energy that is required for your daily activity, for your cell, tissue, organ, and system to function. So what that means is that once the glucose that is in your blood is circulating, a key is required in form of a catalyst, in form of a transporter. We call it GLUT2. That is what push the glucose down to your liver for storage in form of a glycogen, down to your cell in the muscle in form of in the fatty area of your body for storage to produce currency of energy. Once this key is absent, the person can have continuous circulation of glucose in the blood, which we refer to as the diabetes. And this key that is required to drive glucose from your blood so that it can be stored as glycogen in the liver or stored in form of fat in the muscle, as the case may be. If this glucose is absent, we call it type 1. But in the type 2 case, there's an ability for this insulin, which is produced by the isolate of Langerhans by the pancreas, to be producing maybe in a smaller quantity in type 2. But your body is not sensitive to it. That is what the type 2 is all about. The pancreas we are talking about is just an organ in the abdomen, which is the lower part of the stomach, you know. It produces this insulin that is required for the transport of glucose from your blood. When this pancreas produces insulin, your body does not even know that the insulin is there. In that case, the sugar level continues to circulate, and you will begin to feel hungry, even when you have high level of sugar. That is why we call it suffering in midst of plenty. The type 2 diabetes is the commonest type of diabetes. 90 to 95% of diabetes is ascribed to the type 2. And it's very common to persons after the age of 40. And the other risk factor for it, those who are obese, those who live sedentary lifestyle, those with high BMI. So you get to understand that in type 2 diabetes, there are some lifestyle modifications
that one has to go through.
You have to, you know, adopt to prevent the type 2 diabetes. Then the type 1 diabetes, which I almost explained, it means that the pancreas, which is the organ that produces insulin, is defective, maybe as a result of autoimmune disease. It does not produce insulin. Thereby, when the person consumes any carbohydrate food, the end product, which is the glucose, ends up in the blood, circulating, and there is no key, which is the insulin that is produced by the pancreas to push them down to the liver or to the muscle for storage. It therefore means that the person lacks insulin. And therefore, insulin must be required for this person to be able to digest and metabolize this, you know, carbohydrates.
And also function properly.
And also function properly. So, other than this type 1 and type 2 diabetes, we also have what we call the gestational diabetes. So, women, parturients, pregnant women, when they get to the age, when the pregnancy gets to 20 to 24 weeks, or say from 20 weeks, their sugar level gets elevated. But not all group of pregnant women will have this condition. The risk factor is for women that are obese, with high body mass index. You know, such women that have this gestational diabetes, when they deliver, most often than not, the sugar level tends to come back to normalcy. Because in pregnancy, there's what we call hormonal influence. This hormonal influence might tend to decloud or tend to, you know, inhibit the function of the insulin in such a way that the body will no longer be sensitive to the presence of insulin. That's how this gestational diabetes occur. It only occurs among pregnant women. And we have to know those women that are diabetic in pregnancy, there's a need for us to detect them, to sort them out, to treat them properly. If not, they may have complications. That might be the reason why they may have a CS, because they can have what we call the macrosomic baby, giving birth to big babies.
Okay.
They can have other complication. It can even result to hypertension, thereby, making them prone to preeclampsia or even eclampsia, as the case may be, that might make them to convulse during the course of labor. So you understand that diabetes, as I said earlier on, affects male, female, every age group. Apart from these 3 types of diabetes, we still have other type of diabetes that is not too common. For example, the Whipple diabetes. What it means is that some persons have what we call the elevated blood sugar and low blood sugar.
Okay.
When the pancreas is defective, in that case, it can produce little insulin, it can produce high insulin. So that might be the reason why the person will have elevated blood sugar, low blood sugar, thereby resulting to frequent admission.
Okay.
Another form of diabetes that is not also too common is what we call the type 3C diabetes. As I said earlier on, I said the pancreas is the organ that produces insulin. So anything that is capable of affecting the pancreas, any injury, maybe as a result of pancreatectomy, surgical removal of the pancreas, or pancreatitis, inflammation of the pancreas, or maybe iron accumulation in the pancreas, what we call hemochromatosis, or cystic fibrosis, disease condition affecting the pancreas, as the case may be, that might cause the pancreas not to be able to function well or carry out its, metabolic activity. That might result to diabetes.
Okay. So in all of these, you have talked about the 3 major types of diabetes and also other types following the 3 major types of diabetes we have. Now, talking about all of these, someone might be at home and not even knowing that he or she has diabetes. Now, are there some symptoms we should look out for to know that, okay, this is what is actually happening to me, or this is the sign I'm seeing, the early signs I'm seeing? So what are these symptoms that one needs to look out for?
Yes. At that point where the food that you have eaten, usually carbohydrates, is metabolized into glucose and that goes into the blood to be circulating, the key required to push this glucose away from your blood is the insulin.
Okay.
And once the sugar, elevated, blood sugar begins to turn, circulate around, it can be toxic to the body. In that case, the person will now begin to manifest symptoms of excessive urination, passing, high volume of urine, what we call polyuria. Okay. The person might even pass urine up to like 3, 4, or even more at night. Not only that, the person that, urinate frequently will begin to also feel tasty. What we call polydipsia. Not only that, the person can begin to feel weight loss because the person that urinates frequently will lose water in the body. That might be the reason for the weight loss. And not only that, because of the energy required, because the glucose that the person consumes are no longer stored in form of adipose tissue for muscle formation. The person might also begin to feel hungry, as the case may be. What we call polyphagia, that may make the person to even, eat excessively.
Okay. If one is also feeling weak, like you've eaten, you've done the normal, taking water and all of that, and you just done the little house chores and you're feeling weak, is that also part of the symptoms?
Laboratory investigation, of course, is required for you to be able to diagnose that, oh, this is diabetes. There are other conditions that might make somebody to be weak, other than this diabetes. But a situation whereby you feel weak all time, there is weight loss, there is
Excessive urination.
then dryness of the mouth,
Okay.
or possibly in the female, there's what we call the excessive fungal infection, usually the genital tract.
Yeah.
It's just like a female that is always having recurrent genital discharge.
Infections.
You know, that might be, you know, diabetic symptom.
Okay.
Not only that, you might even begin to feel some skin changes. There are some skin conditions that may come up as a result of, you know, diabetic disease condition, or called acanthosis nigricans. Not only that, for somebody who suffered diabetes for a very long time, and he or she is not aware, they might begin to have what we call the acute or chronic symptoms.
Okay.
Commonest chronic symptoms might just be peripheral neuropathy, with which you might step your leg on the ground. It's like there's a needle prick. You know, you can feel numbness.
Okay.
You can feel, oh, your part of your body, maybe your foot or your hand, is no longer part of your, you know,
You can
body.
feel things
no longer,
as you used to feel
exactly.
them.
Because
Okay.
what happens is that this excessive blood sugar that is circulating, it can get deposited in the capillaries.
Okay. Okay, you know what will happen, Dr. Jolly? We will have a pause there and go on a short break. Remember, we're talking about diabetes, the causes, symptoms, and also possible treatments. Don't go nowhere. All right, many thanks for rejoining us on the program Healthy Living, and we're looking at diabetes. Now, while we're on break, myself and Dr. Jolly were talking about some persons getting injured, and you find out that it takes so long a time for that injury to, you know, to get healed. Now, is this part of the symptoms of one having diabetes?
Yes. You see, we're almost talking about the complication, and I said something about the neuropathic, peripheral neuropathic effect of diabetes. For the fact that the high blood sugar level is toxic to the body. So those high sugar level can get deposited in the capillaries, thereby affecting the nerves function. What it means is that those nerves usually within the lower extremity, which is the leg.
Downwards.
Yes. When they get affected, means that even a slight injury will make them not to heal well. So I will tell you that the commonest cause of amputation worldwide, you see somebody with a amputee, you know, somebody with amputated leg or a foot. The commonest cause, other than trauma,
accidents and all of that.
Is diabetes.
Diabetes, okay.
So you can get to understand that diabetes is actually a scourge. It's actually a disease that everybody needs to understand.
Take serious, yeah.
It's not even a disease of the rich, as we used to think. That is a
rich man's
disease,
yeah.
Or it's an old age disease. I will tell you that even newborn baby can suffer diabetes. There's what called neonatal diabetes.
That's passing it on from mother to child.
Possibly, you know, the truth of the matter is, I said something about the gestational diabetes. A woman that is pregnant having diabetes, because it's more or less like pregnancy-induced diabetes. The high sugar level of the mother can cross the placenta, thereby inducing the pancreas of the baby now to start producing enough insulin. That might even cause hypoglycemia. What will cause the baby to die immediately after birth, or even in other way around, cause a form of excessive production of insulin. So you now understand that diabetes can cause both acute and chronic complication.
Okay.
The very common chronic complication is heart condition. So I tell you that cardiovascular disease is also another common cause of death worldwide.
Yeah.
And diabetes has also been reported as the cause of cardiovascular diseases. People with cerebrovascular accident in form of a stroke, I will tell you that stroke does not just come
on its own.
It might be as a result of somebody suffering from
diabetes,
diabetes or hypertension, as the case may be. So not only that, somebody can also have blurry vision. what we call diabetic retinopathy.
Yeah.
Because the diabetes can also affect one eyesight that will make somebody not to see very well. Not only that, diabetes can even affect one's kidney, what we call diabetic nephropathy.
So in a nutshell, diabetes is something that one needs not to toy with.
Yes, and I tell you that you cannot actually have any of those symptoms that you now suspect
it's diabetes.
Because they don't call differential diagnosis.
You actually need to go to the hospital.
Yes, because there are laboratory investigation you must have to carry out.
Yeah. Okay, in all of this, can we quickly know the way one can actually prevent all of this?
Yes.
In as much as we know, you said when you have too much insulin in the system, and all, so how can this be prevented?
The prevention will be on lifestyle modification.
Okay.
Of all the diabetes that I've given, I said the commonest one is the type 2. And 90 to 95% of all diabetes is type 2. And people that are usually affected by the type 2 diabetes are the people that are obese.
Yeah.
People that, don't exercise. Aerobic exercise is very important. Try and take a brisk walk, do exercise. Sweat out. So living sedentary lifestyle, staying in the chair for a very long time, you are making your body to get resistant to the presence of insulin, thereby getting you prone to what we call type 2 diabetes. Body checkup, reduce your stress, eat good food, reduce your carbohydrate intake, take vegetable, take good grains, body checkup, all these are the things that you have to put in place to ensure that you don't develop what we call type 2 diabetes. But in type 1, it runs in the family. There might be nothing you do about it.
Okay. So when you
for as much as your father or your mother, it might be passed. We say genetic as the case may be. But notwithstanding, the type 2 is still the commonest. Okay. And you can actually prevent it by, maintaining a good
lifestyle. All right. So in a nutshell, we need a summary of all we've said. So what's your advice to everyone out there?
Yes. Diabetes is a killer disease, and it's a chronic disease. And once you are diagnosed of diabetes, there's a need for you to be adherent to your medication. And not only that, diabetes is a disease that requires multidisciplinary approach. What it means is that the dietitian, the physician, the podiatrist, they all play a role in managing a patient with diabetes. But in this our outland, in our environment, I'm very sure that diabetic patients don't even get support from the government. Because there are some persons that have to live with drugs for life. And for those who have type 1 diabetes, even sometimes those who have type 2 diabetes, if they have some condition, even those that take oral hypoglycemic drugs, those who take drugs for life, there might be a reason why we say, okay, they have to be converted to the insulin injection. And I will tell you that the insulin injection is very expensive. A 10 mil of it that will not last you up to 2 months, last you up to 2 weeks, is sold for up to 18,000. And you might need up to 2 vials in a month before you talk about feeding. What is the minimum wage? So you can see that managing diabetes most times is not easy.
It is an erroneous task.
Exactly. And it's only a thing that even the wealthy, those who have money, can be able to tackle. But for those who live from house to mouth, it's very difficult.
All right, Dr. Jolly Osai Eguma, thank you so much for being part of us today, for educating us on the topic diabetes. Now, he did make mention of exercise. That is something I have taken upon myself to do. Like someone would say, 30 minutes, it's enough for you to exercise, and also do well to go for check-up and take your routine drugs. All right, so we'll be seen again next week for another exciting time on Healthy Living. Call someone today and ask after them and ask how they are doing. Till then, do have yourself a blessed day. Bye for now.